Cranhold. I ruptured my first Achilles tendon in December 2005, and did the second one in 2006, in June of 2006. The first one, I had the open procedure. Didn't know about the percutaneous method. During my rehab, a friend told me about the percutaneous. Unfortunately, a few months later, when my second Achilles tendon ruptured, I looked into the percutaneous method and found out that there was one physician in Northern California that did this, Dr. Stone, and I had that procedure done. The differences I noticed between the two, I injured them both playing squash. I played squash for 25 years, and my goal was to be able to continue playing squash, and I have been active over the last 5 or 6 years playing. The big differences I noticed were with the open procedure. I was in a cast for several weeks and completely immobilized. Whereas with the percutaneous method, I was in rehab the very next day on a bicycle, and as a result of the non-invasive percutaneous procedure, I experienced a lot less scar tissue, and so mechanically the tendon is interacting with the muscle as it always has. And whereas with the open procedure, the surgery, they had to cut through the skin, cut through the sheathing in order to access the tendon, and then suture it all back together again. There's still, 6 years later, tremendous scar tissue in there that is inhibiting the normal mechanical movement of the tendon and the muscle. So as a result, my calf muscle on the open leg is very small compared to my calf muscle on the percutaneous leg. Strength-wise, the tendons are both healthy. I got an MRI today on both of them. But the open procedure, the suture material that they use to stitch the tendon back together will remain inside my and attached to my tendon forever. Whereas with the percutaneous method, that is dissolved and gone away, so it's just the original tendon. So that is also, I think, contributing to the normal mechanical movement on the percutaneous and the non-normal movement on the open. If I had it to do all over again, for any of my friends who are all active squash players who are experiencing Achilles pain or have experienced a partial tear, or in some cases even a total tear, there's no doubt that I would go the route of having the percutaneous method. If I could go back in time and have made that decision with my first Achilles tendon injury, I would have done it. So I highly recommend the percutaneous method. I wish more people were doing it.